welcome to Mental Health Monologues. My name is Natalia. I am a licensed clinical social worker in the Orange County area of California. This channel is really meant to help you get information and education on the social work and mental health fields. And with that being said, this is not meant to be or replace therapeutic advice. So if anything piques your interest or applies to you, please take it back to whatever mental health professional you are working with and further discuss it with them. So today's video is really going to be dedicated to answering the question, what is therapy? I've had a lot of people share with me that they put off seeking services because they didn't really know what to expect. They had a lot of preconceived notions about what therapy was, what it was going to look like, what it was going to feel like. And so I don't want that misconception to be a barrier for you to receive services. So let's go ahead and talk about it and demystify what therapy is. So every therapist is going to have a different style or different approach to therapy, but at the end of the day, what we want to help you do is get to a goal. So let's say, for example, you come in with anxiety. Some people's goal is to reduce their anxiety. Some people's goal is to get coping skills to address their anxiety. Some people's goal would be to understand the underlying reason why they have anxiety and have experienced lifelong anxiety. There's a lot of different goals you can come up with, and there's a lot of different goals we can work towards. But at the end of the day, we're helping you towards a goal of yours. So before I really jump into explaining the different phases of treatment, let me just start by saying that services can vary in how long you are in services. So we have things that are like crisis counseling that are very short term, very immediate. So it's typically 4 to 6 sessions, and that is really geared towards an immediate need. We have shorter term sessions or services that are typically around 10, 12, 15 sessions, at least in California. That's about what is considered short-term therapy. And then anything past 15 sessions is typically considered longer-term therapy, and someone can be in therapy for months or years. And that's really up to that person and what they have access to. Now, to explain the different phases, I'm going to just use the short-term therapy model, so the 10 to 15 sessions, to really explain what these phases look like. So let's start with the initial phase of treatment. Initial phase of treatment is really about rapport building. It's really about creating what's called a therapeutic relationship. And we do that by getting a background, understanding challenges and barriers that maybe you have experienced. We want to really understand what it is that you are expecting out of services, what are your goals for services, and how can I help you get there. The very, very first session that you have should really be focused on explaining and understanding your intake packet, which is something that you probably filled out prior to therapy. Talking about what is confidentiality, talking about mandated reporting and privacy practices. Other states may have other things that they typically talk about, but here in California, those are things that we typically focus on. And then the rest of the initial phase is really dedicated to forming that therapeutic relationship, getting that background, building that rapport, all of those wonderful things. Then we transition into our working phase, or our goal-oriented phase, however you want to call it. But as you can guess, it is really about getting you to your goals. How do we get you to whatever goal it was that we established in our initial phase of treatment? Regardless of the duration of services, the middle phase will always be the longest. And this is where you do your work, okay? And then your last phase of treatment, your termination phase, your closing phase, however you want to call it, is typically 2 to 3 sessions. And the purpose of termination is to help a client transition out of services in a healthy way. Not everyone's good with goodbyes. A lot of people actually have a lot of difficulty with transitioning out of services. It can be scary, a lot of unknowns. Assuming you've had a positive experience, some people don't want to leave therapy, but that's the therapist's role, is to help a client transition in a positive way out of services because they've done such good work that we're hopefully transitioning out so that they can continue their journey. And so those are the 3 phases when it comes to therapy. So now that I've shared with you a little bit about the therapy process, I do also want to share with you what you can expect from your therapist and the role of your therapist. Now, please keep in mind that this is coming from my perspective, my style of how I engage in therapy as a therapist, and everyone will differ in their approach. So please keep that in mind. But first and foremost for me is that I am here to walk a journey with you, not for you. I will have people come in with this expectation that because I am the therapist, I have all the answers and I should tell you what to do. And that is not the approach. If I am your therapist, I am here to help you facilitate a journey and to walk with you through that journey. And I come from it from the perspective of um, if if you want to feed it someone, if you want to feed them for a day, fish for them. If you want to feed them for a lifetime, teach them how to fish. I am teaching you how to fish. That is the kind of therapist I am. And as harsh as it might sound, and I've said this to some of my clients, is I don't necessarily want to see you back here. I do not want to become your crutch. I do not want you to need therapy to get through life. I want to help teach you how to be successful in this journey, in this goal, in this whatever, so that you can walk on your own because you have multiple stops on your journey, whatever that looks like for you. There are multiple stops, and I am only here temporarily. What happens when I am no longer with you? I would be doing you a disservice as your therapist to do it for you. And so I am here to walk with you, not for you. So that's first and foremost. When you come to me as your therapist, that will be the lesson or the approach that I will have. The next important thing for you to know about therapy is that in order for therapy to work, it is an active process. There are some people that think that there's going to be a magical moment in therapy that will change everything. And I really hope you get that because those are really awesome moments. I have seen them with some of my clients, but for the most part, therapy is about gradual change, personal successes over time. And in order to achieve those things, someone has to be actively engaging in therapy. And what that means is that the hour that you spend with your therapist is just the beginning. The thought is that between sessions, you are actively working towards or doing something to engage in the goals that you have set in therapy. If you are going to therapy, sitting there for an hour and just talking to your therapist and walking out and never thinking about therapy until you go back, your progress is likely going to be much slower than the person who goes to therapy, actively thinks about or works on whatever we talked about in therapy, and comes back with, this is what I worked on, this is what worked, this isn't what this is what didn't work, this is what I thought about, this is what I observed. That is going to be a much faster process because you are engaged. Okay, so therapy isn't just about sitting there and talking. As much as that's what sometimes the misconception is, it's not just about sitting there and talking. You do need to be active in therapy because it's not a magic wand. There's not going to be just one thing that I say or that we talk about that's going to be like, aha. That's not how it works. And so when you come to therapy, come ready to work. When you're coming to therapy, at least with me, is that there is this misconception that therapists and mental health professionals, we're all rainbows and butterflies and we're going to just tell you what you want to hear and things like that. And that is not the case. I have had to tell many of my clients that I'm here to do what's good for you, not necessarily what you want me to do. So I will tell my clients and point out to my clients behaviors and patterns and behaviors that are probably working against them in their goals. And sometimes that can hit hard. I have had people that I've worked with that are like, oh, Natalia, why'd you have to point that out? Why'd you have to say that? Because it's what's good for you. Not necessarily what you want, but it is what's good for you. And when people are ready to hear those things, they can be very powerful. But if you're coming to therapy and you're expecting your therapist to just tell you what you want to hear, you are probably in for a rude awakening because not only is therapy requires work, your therapist will likely challenge you not in a negative way, but they will challenge you to see things from maybe a different perspective, to try something new. And that is my role as a therapist, to do what is good for you, not necessarily what you want me to do. When I work with someone, I view our relationship, what is called therapeutic relationship, as a collaboration. I mentioned a little bit earlier that some people take this perspective of, well, you're the therapist, you're the expert. And I may be trained in mental health, I may be trained as a clinician, but you are the expert of your life. And together, working together is how we get you to your goals. And what I will do is that I will often share with my clients, a theory or an observation. And my clients will sometimes come back and say, that doesn't quite sound right. I'm like, okay, what didn't sound right about it? What didn't feel quite right about what I said? And we'll talk about that, and that will help us get to the next thing. Or some people will be like, oh my gosh, I never thought about that until you just said it. I never put those two things together. Okay, so now that we have those two things together, what does that mean for your goals? What does that mean for you? And then that's now a new point to talk about and to explore. And so I view therapy as a collaborative relationship. So the last thing I really wanted to share is that therapy is goal-oriented. It may not always feel like it, but as I mentioned before, in your first phase of service, the first phase of your services, you are establishing a goal. What do you want out of services? What can I help you with? And it is my role as your therapist, as your mental health provider, to get you there. And sometimes there's misconception that you go to therapy and you just go there to talk. You're just going to talk about whatever. And that's not true. And we're going to talk about your goals and the topics that surround that. And sometimes it might feel like it's not connected when it really is. That's the role as a therapist, to make sure that what we're talking about is related to your goals. But it is goal oriented. And so, as much as it doesn't seem like it's a lot of work, therapy can be a lot of work. And sometimes it can be a scary journey, but hopefully you are paired with a therapist that you have a really good relationship with, that you trust, and you can see that supports you. Because hopefully that therapeutic relationship is what's going to get you through those scary things, the unknowns, the things that maybe you have been avoiding. And that person, that therapist, is really creating a safe environment for you. That's one of the primary goals of, or purposes of, a therapist, is to create a safe environment to face the things that maybe you've never really wanted to, or can tell you in a supportive way. Maybe your behavior, patterns in your behavior are detrimental to you, and it's still a supportive environment. And that is really what the goal of therapy is, or the goal of the therapist, the role of the therapist is. All right, that is it for me today. Thank you so much for joining me. If you enjoyed this video, go ahead and give it a thumbs up. Subscribe if you want to hear a little bit more about the mental health and social work fields. If you have any questions, comments, or would like to have a specific video or topic discussed, go ahead and leave it below. I'd love to hear from you. And with that being said, you have a wonderful day. Live your passions, love your journey, and I will see you next time.